Ladies and gentlemen, welcome to the meeting of the Rutherford County Benefits and Insurance Committee. We will now call the meeting to order, and I believe you have a copy of the minutes of the last meeting, and we need a motion on those minutes. Ms. Hickerson, we need a second. Mr. Sellers, did anyone have any corrections or additions? All right then, all in favor of that, please say aye. Any opposed? Thank you very much. Now, Mrs. Stinson will review with us the financials.
You'll refer to Fund 264. We'll start there. For the month of August, our per employee per month was $960.34 compared to prior year, the same period of $1,087.04. When we combine the on-site medical clinic experience for the month of August, our total per employee per month is $989.02 compared to the prior year same time of $1,118.35. Currently, at the end of August, we are trending 22% above prior year's trend at this time. We can move on to Fund 266. Our year-to-date at the end of August is $195,123.89 compared to prior year of $98,509.94. So we are trending slightly higher for this time of year compared to prior.
Okay, do we have any questions of Ms. Stinson for a brief 2-month report, which doesn't give us much of a trend yet? We'll just have to see how it goes. Any questions? Okay, if there are no questions, then the financial report has been presented. Next, we're ready for Mr. Good, I believe, to tell us about workers' comp and OJI.
Good afternoon. In the month of August, we had a total of 18 injuries requiring medical attention. On your report, you'll see the breakout there. That brings the total for the year-to-date to 122. Of that 122, 90 of them were OSHA recordables. 43 had restricted days to the claims. There were 16 lost time injuries and 31 total others. On the next page, you'll see the graph there, and it'll kind of depict where we're comparing this year to the 2 previous years. Just to help you a little bit, in 2012, as I told you just moments ago, we have 122 claims. Last year, in 2011, at this time, we had 163 claims. And in 2010, we had 134. So we are down on the number of claims we have. The total dollars for those 18 claims that we've incurred is $36,057. Of that, 8 of the claims are with the county general, and the total dollars incurred for those is $19,650. The highway department had 1 claim, and you can see the amount of money there for that 1 claim. And then finally, the next page, you'll see that the Board of Education had the rest of the claims, a total of 9 for $7,950 at this time. The last page, what we've done on it, we've taken the county general and we've broken down those 8 claims for the county general and identified where those 8 claims are in the county general with the highway, the clerks, and emergency management, solid waste, and you'll see the breakdown there. Are there any questions? Yes.
On this data that you're giving us, once we see it on the report, that means the claim is finished, paid in full, or is it still ongoing?
It's still ongoing. A claim, that incurs, that comes in the month of August, it may be a month or 2 before an individual has been released from the medical doctor, and then in addition to that, for billing for those treatment and all, maybe another month. So a claim could be open 3 or 4 months until the billing is all closed and everything like that.
Okay, so the payment for that claim might be spread over a 2 or 3 month period.
Yes, but this is the month, the claims that actually occurred in that month, and the incurred dollars is an estimate on what it's going to take to close that claim out. Now, as the months progress or the time progresses into that, the claim might actually close sooner, so it would be less dollars, or it might actually incur additional costs if referred to a specialist, something like that, and then there would be additional dollars. But this is a snapshot of one day for the claims for last month.
Any other questions regarding this report? Okay, then, thank you, sir. Appreciate that. Now we will hear from Ms. Perrion with respect to the wellness report.
Good afternoon. I'd like to talk to you guys about the wellness report. Lori and I have been working on Wellness on Wheels with Jeannie Herndon with Cigna, and we went to 3 events in August. We serviced Siegel High School, Community Care, and Lang Agro Park. We had a total of 91 participants out of 251 eligible employees, so we had a participation rate of 36%. And Lori Cook ran the Colestech machine at 89% capacity. We also went to the DI conference at Siegel High School in July and August, and we had 331 participants at our table, and 180 of them did a DermaScan check. For individual MedPoint health coaching, we closed 8 cases in August, and we have 8 open cases, 2 of them new, and 6 of them were follow-ups. We are planning our wellness fair for October 12th, and that's opening the flu clinic. The flu schedule is on the back of your report if you want to check those dates or post that up. These flu shots will be free to all employees and their spouses. No children or anybody under 18 will get shots at the wellness fair. And you do have to bring your insurance card to get the shot. I've also included in your report our new brochure for the wellness and MedPoint clinics, as well as a postcard flyer for Cigna Healthy Babies program that we are going to mail out to all active employees in the ages of 18 to 40. Cigna provides an incentive program if you sign up for their Healthy Babies, so we're going to send this out to everybody just to make sure that they are aware of the programs. Anybody have any questions? Thank you.
Let's see then. Next, we want to talk about Benesync Hidden Paycheck. Mrs. Stinson.
If you'll look inside of your packet, there's a color brochure for your review. The hidden paycheck offered by Benesync is actually a 2-page document, and I've actually copied it on front and back for you. If you refer to the back of the compensation statement, that's really the important portion of the document. I had discussions with both the HR directors for the Board of Education and County General and talked about the total compensation statements. I believe we've done these one time prior in the past. In talking with the Board of Education, the subsidies that teachers received become a little bit of a challenge in trying to determine the total compensation for reporting purposes to produce a formal document like this. And in those discussions, it was determined that the Board of Education would not want to pursue a total compensation statement such as this. However, County General continued to show interest in it. We actually met during the Mornings with the Mayor meeting, which is a meeting held with directors, elected officials, and department heads, and we talked about the total compensation statement and what all it entails. And as you can see from the document, it is an overview for employees that shows not just their payroll information, but also their benefits, as a total compensation for them as an individual within the county. So what is the county investing in you as an employee? It goes on to further show the breakdown on the benefit side of what does the county pay on an annual basis for your benefits versus what are you actually paying out of your pocket. So if you look at the example in front of us on the share of benefits located on the right hand, it lists all of the benefits, and it also shows that the employee paid 43% of their benefits for the cost for that given year, and their employer paid 57%. I think that's very powerful information for employees to really understand what is being done, not just by the county as an employer, but any employer, because there is an investment made in them as someone within that payroll. The cost for doing this for 1,200 employees is $7,050. We did, after discussions during the mornings with the mayor meeting, get the agreement from those in attendance that they would actually meet with their employees to go over this information with them. We don't want to make an investment like this and have it arrive in the mail and possibly be thrown away as junk mail or just laid to the side with good intentions of being open, which someday I'm going to get to my own personal stack of that. But what we want to do is make this meaningful. So we do have that commitment. What I'm asking from the committee today is to consider allowing for these to be mailed out to the county general employees.
Okay, you hear the request. Now, Ms. Stinson, from what sources are we going to pay for this if we choose to do this?
If it's approved, it will be paid out of the insurance fund to cover the cost of this mailing.
And you indicated this may have been done previously, is that correct?
Yes, sir. I believe it was done somewhere around 4 years ago, possibly. Is that right, Ms. Stevenson? Does that sound familiar? About 6 years ago.
And who was here during that period that can tell us whether that was appreciated or a worthwhile effort? Ms. Hickerson.
It is very informative, and just speaking of the few guys that I have out at work compared to the rest of them, when they got it and it had their name on it and it was their information, they come and ask me about it. Instead of course, I have a privilege of having a smaller group that when like open enrollment information goes out, I can say, be looking for it. But when this come in and it had dollars on it and had their name on it, they paid attention and wanted to know what was it about. And some of them did not realize as simple as the sick and vacation and holiday pay. You know, when you put a dollar amount to that, especially the ones that have been there that are actually getting 16 hours of vacation and 8 hours of sick, it really drives home. So what if I do not make as much as the private truck driver, but I have all these benefits that they don't? So it is something that if they'll take time and look at it, and like I said, they did come and ask me about it. And generally with my group, they don't ask a lot.
Okay. Any other comments or any other questions? Ms. Stinson and the department heads that we've talked to and the office holders have indicated they would like to do this, and it will cost us $7,050. Do we have anyone that's willing to make a motion? Okay, so have a motion, Mr. Hall, and Ms. Hickerson seconds that motion. Any further discussion?
I have a question. I believe I heard you say, or somebody say a few minutes ago, that the school system did not want to pursue this. What was the mindset there? I mean, if it's good for county general, why is it not good for the school system? I'm just trying to understand what their thinking was.
Mr. Sandvik.
If for those employees we have who are 12-month or 10-month teachers who don't have any supplements, who aren't indexed, who don't have additional days, for that core group, it works very well. For our part-time people and 10-month people, 9 and 10-month people, it does not. And then you also get into, we've got 8% roughly of our certified teachers for whom it would be disinformation. That's what happened when it was done before. Just the way the payroll system works, but the way the data is entered on those groups of people, it does not translate.
We have too many different situations and types of treatment of various numbers of employees that the data might be inaccurate and not really something that can be presented in a form that's understandable and clear. Is that what you're telling us?
Mr. Sandvik, didn't you all experience some of that last time with the other compensation statements? I think that's the feedback you had given me, was that you actually, when they went out, you were trying to do some cleanup on the back end, and that was part of the decision as well.
Okay, we have a motion and a second, and we've heard that now. Mr. Sandvik, if the school board determines that 80% of those employees out there are so routine and standard that you want to do it for a select group, I'm sure they could entertain that.
We can't sort them from the payrolls.
Okay. Ms. Hickerson and somebody else, I think. Okay.
Going back to the school board, the biggest thing, and really to all employees, but the benefits because you're talking about pay and supplements and things that on the teachers and part-time and everything. The salary, could we not somehow put a disclaimer or something that says not quite, may not be accurate for Board of Education group, however, the benefits, this benefits list, because we get a lot of folks wanting, and mainly teachers, and because, you know, they see this stuff and there's more of them too, but this would be, to me, it'd be beneficial information to them also to know, if nothing else, what the county pays for their medical, their dental, you know, their sick days and time off like that, that I realize that, you know, how their pay is done is a little different, that a little disclaimer or something could be put on there, but they need to see also what the county puts, and the county being Board of Ed also, what they put out for the teachers. Because a teacher may see, just like my truck drivers, that, I don't know, Metro may make more on the hour or ever how they're paid, but does Metro have the benefits we have? Just like my truck drivers could make a whole lot more on the hour driving privately or something like that, but they don't have the benefits of the sick days and the vacation days and what the county puts out on their part of the benefits for health and dental insurance.
And then Mr. Sandberg wants to say something of us.
Let
Mr. Sandberg go ahead and respond while he's fresh on his mind.
I have worked with these before. One of my projects at Gaylord was doing this for a large group of our employees. And the results I saw with that and the results from when it was done earlier, if your salary figure is not right, and many of these benefits are driven by salary level, my experience was it destroyed the integrity of it. They didn't trust any of it if the salary was wrong.
Okay, Ms. Stevenson?
The only thing I was going to say, and just trying to think outside the box so that there was something where, on the line where it talks about your pay and it says current annual pay and bonus commission and all that, and I don't know if this is how you're set up, but if the teachers had a base pay, I understand that they get stipends and if they coach and get supplements like that, if their base pay was on there and where we have bonuses, commissions, and everything like that, you just left that and put varied or whatever, or unable to, I don't know, just trying to think outside the box on somehow they would get this information with some of the information that they would have so that they would have some of that just as an alternative to trying to come up with their exact salary, because I know that you have several different things, you know. It's just a...
Okay, Mr. Sandberg?
The payroll system does not have enough for our 9 and 10 month hourly employees, enough information to come up with that number.
All right, we've had this discussion, and I guess we're saying the insurance committee and the department is certainly willing to do that, but if the school board thinks this is not practical, I don't think we should pursue it. So we'll leave it at that. I guess we could say that if after further thought, the school board and Mr. Sandvig determine it might be something they want to reconsider, we still have time. So, but for right now, we have a motion on the floor to do this for county general employees. Is that correct?
Yes.
And I guess we should include ambulance and solid waste. Is that what you're really counting those?
All non-Board of Education.
All non-Board of Education people, okay. Any other discussion? Ms. Stevenson?
Just have a question. I don't recall, when were we going to send this out?
Won't do it till after the first of the year. We'll coordinate with you and Human Resources on the timing of it. We want to actually capture the new elections under open enrollment, which is the month of October, and actually go in and calculate their benefits package based on what they were enrolled in 2013.
Sometime after the first of the year. Okay.
Okay, any other questions or discussion? Ms. Harvey?
Who is actually going to be sending this out? If we're paying $7,000 for this, who is doing this?
A company called Benesync is actually, they're part of Cowan Benefits. Cowan Benefits is the one that brought this to us after it had been inquired about. And so Benesync is actually the company where we'll send all of the data to, and they will populate these for us.
Okay, if there's no other, I still have a question from Ms. Stevenson.
Just to kind of give you an idea how this got generated, several of the department heads, after I came to the county, and even when we did salary surveys and their pay came out, several of the department heads said that they were getting feedback from the employees in their department that they had this type information once or twice before and was very interested in receiving it again. The department heads said that the elected officials, department heads all said that it really helped when they sit down with their employees and went over their salaries, that this was a nice tool for them to have. And so I asked the question to Ms. Stinson to see how they did it before, because it wasn't generated out of the Human Resources Department. In the prior times, it had come out of the Insurance Department that time as well. So I inquired with her if she could do some research to find. So really that's how this got started. Somebody asked me, then I asked somebody else, and it moved on. The feedback that we're getting from when we have our leadership meetings is that a lot of the members of the team were wanting this for their employees, and when I asked the people in my department, they said that they were very interested in having it as well. So that's kind of how it got started, just so you know.
Okay, Mr. Hall.
One question real quick. I was curious about, can you use this right here, or can the department heads or in HR anyway, when you're doing a new hire, whenever a person's considering a job somewhere else or something like that, and you're sitting there going over with them, it's like in trucking, something like that. Can you use this right here as a tool to show them your base pay may be this, but you add in all this other stuff? Can y'all can save? I mean, you may have to blank the names out, I'm saying, on something in your department, but can you use that as a tool when you're hiring other new employees and stuff?
Ms. Stevenson, what would be your judgment on that?
I don't usually ask that from the beginning. We do cover, when they come in for orientation, we cover their retirement benefits and what the county pays. We cover that they have several options for insurance. We cover their vacation days and annual days. As far as putting a dollar figure to it, we don't. Usually when a new hire comes in, by the time we explain all that to them, it's a really good benefits package. It's only after they've been here for 5 or 6 years where they start saying, is the grass really greener on the other side? And this is where the helpful tool comes in. No, it's really not. You know.
Mr. McAdoo.
Got one quick question. Why can't we do this in-house? You mean we don't have the information to get it together in HR and insurance department and mail it out, that we have to have a consultant to do it? Why can't we do it in-house?
In order to do this, it would take programming resources that I don't have available in my department, nor does Ms. Stevenson. There's also formatting and other things that you see here. I couldn't make it look this way visually, and I can't formulate the information in this manner because I lack the programming resources to do it.
It doesn't bother me how it look, is that we got a system department. Have you ran it by them, or?
No, we haven't talked to the IT department about this, about building it from a homegrown system. No, we have not.
You know, all they want is the information. I don't guess they care how it look. You know, pretty pie graphs and all that good stuff or whatever, but it just seems to me if we got a system, we got this information stored, that we should be able to pull it from our system and mail it out.
I would have some concerns about the timing and the relevance of the information if we were to do it internally. We are right now on Monday beginning open enrollment, and for my department of 7 people, we will be maximized through the end of the year in terms of managing open enrollment and the responsibilities that we have after open enrollment. In addition, we will have some bids that I'll be coming back to you in November to request that we'll be releasing out at the beginning of the year. So I'm not saying it's impossible for us to do. I'm saying it would be probably summertime before we could actually produce this manually in our department. And at that point, we're 3 months out from open enrollment again. And so then the county is still making an investment because you're going to have man hours associated. You're going to have some programming costs associated internally. And at the point that we're doing it that late in the year, is it as meaningful? My personal opinion is no. I think that the beginning of the year is a much better time frame.
That's something we could look at, because the IT department, if they program and set it up, then it would be available for us on a yearly basis. And then we wouldn't need nobody, no consultant or nothing else to do it. But, you know, trying to do it maybe with your time frame, maybe it's a good idea based on your time frame. But if we got an IT department, I think it need to be passed to them and see can they set up this program for future use.
Okay, so Mr. McAdoo, we could check with them and see if we could go, maybe not go at this first go-round, but maybe next go-round or what? Okay. And then Ms. Stinson and her department, I mean, they have to be the ones to coordinate this and help design this and tell them exactly how it should work and how you make these computations. Okay. Any more discussion? Assume you're ready to vote then. All of you in favor of allowing Benesync to create this hidden paycheck document for our county general, quote, and all other groups that we mentioned earlier for this first go-round for a cost of $7,050, please say aye. Any opposed? Okay. Ms. Harvey. Okay, thank you. Now let's go for next agenda item is Take Care Retail. And Ms. Stinson, tell us about that, please.
Okay. You have information in your packet. It actually says Walgreens at the bottom right-hand corner and Take Care on it as well. Our contract with Take Care reached its first-year anniversary on September 1st. Pricing was a consideration as well as service whenever we made the decision to go with Take Care. Specifically, one of the things that we reviewed was the expansion into retail. I've been in discussions with Take Care for the past 6 weeks or so, looking at the availability to expand into retail. And why are we reviewing this now? One is because we have reached maximum capability inside of our clinics. We have extended the hours as far as we can with our staffing levels. We've also reached, from a facility perspective, maximum location. I did work with Mr. Clardy at the Board of Education some time ago to look at possibly building another clinic on the back of Rock Springs Middle School, and that neighborhood about $250,000 to actually build that facility. So those were some of the considerations made as we began to look at the expansion into the retail market. What we would like to do is to, effective on February the 1st, begin allowing the Middle Tennessee locations of Take Care to accept Rutherford County medical plan participants where they can receive the same like services at a retail clinic that they would receive at MedPoint. If they are in the copay plan or the deductible plan, then there would be no charge for that retail service, as long as it is a same service that they would have received in one of our clinics. If it is a non-eligible dependent today, meaning that it is a dependent below the age of 3, because Take Care Retail treats 18 months and up, or if a service is received that we do not currently provide in MedPoint, then that would follow the standard insurance benefits just as it does today. In doing that, what we will gain for our employees is an additional 1,048 hours per week. If you'll look at the Access to Care After Hours document in your packet, you can see that 5 days a week, their clinics are open till 7:30, whereas ours close between 6 and 6:30, and we're typically only open that late at one location. In addition, they have Saturday hours till 5, whereas we have Saturday hours only at the Blackman Clinic till 1, and we do not have Sunday hours where the retail clinic does. So we would gain access, obviously, for our employees. If you go through your packet, the next sheet shows you how the process would work. A Rutherford County employee participating in the medical insurance will be given a sticker, if this is approved, to put on their actual medical ID card. When they go into the clinic, at that point, they will be visually identified as a Rutherford County employee. That's the first step. Once the insurance is recognized, either visually or by running it through the system, they will then receive the same benefits as they would if it was MedPoint, should it be a service that would have been duplicated in our clinic. Once their visit is completed, a summary would be sent to the Blackman location of MedPoint, and it would be entered into our EMR system. If you've ever visited a Take Care retail clinic, you will get a follow-up from Take Care within a couple of days. What will also happen is our providers internally, so if you routinely see Dr. Venegas in our clinics, as an example, he will have reviewed that visit to the retail clinic, and he will then, if additional service is needed or an outbound call is needed, he will ensure that that happens as well. So there would be a continuation of health care inside of the MedPoint clinics. So the continuum of care will be significantly improved for our employees through that process.
Ms. Stinson, before we go forward, when the person goes into this clinic, will that person there, that provider, have any access to the basic data that's already contained within MedPoint?
That's a good question, and the answer to that is no, not initially. If you look at the top of the high-level workflow, it says it's the crawl phase. Once we go into, you have crawl, walk, run. By the time we are in the run phase, we will be able to do that. But not initially, no, we won't. The next page inside of your packet shows all the different 16 retail locations. We do have one in Murfreesboro, one in Smyrna, and one in Laverne. The improvement in access on the northern part of the county would be greatly improved. As of right now, we just have the limited hours at Rock Springs and then Stewart's Creek Clinic, and we don't have any locations in Laverne, so that would be helpful to those individuals. And we do have a lot of employees that I believe particularly within more so the Board of Education that drive from Nashville, so that would give them greater access to the weekend hours and after hours as well. We had, for the review period of our last review that was conducted by Cigna, which was given to me in October 2011, which was for the prior fiscal year, showed that we had a 34% steerable opportunity out of our emergency rooms. What that means is 34% of the individuals that presented to the ER could have been seen at a lower level of care. So we hope to remove some of our ER cost by expansion into the retail market as well. It's a first stop for employees to go versus going directly to the emergency room if the MedPoint clinics aren't open or they can't get an appointment and they don't have a primary care physician that they can see as well. Within that same review period, we saw that the convenience centers, which is what Take Care, Little Clinics, CVS, they're called convenience centers, our population had a 19% increase in utilization. So we know that our employees will use those type of clinics as well as their dependents because we see the trending continuing to increase. So that's the recommendation today, is for us to go ahead beginning February 1st and press on with the retail market expansion. And just to reiterate, it will be the exact same services provided at no cost if you're in copay or deductible at the retail clinic as it is today in MedPoint. If you are in the HRA, you will still have the $50 copay when it applies, just like you do today. It would be effective on February the 1st. And the initial phase would give us some additional benefit to our employees from a healthcare management perspective. But as we continue to expand the retail and the exchange of data, eventually it would give a greater continuum of care for our employees.
And Ms. Stinson, what are they going to charge us for this additional service?
They will follow the Cigna, actually the Cigna fee schedule. So the cost would be the same for us as it is today, utilizing the same Cigna fee schedule. So it would not be 100% retail cost. It would have the Cigna discount applied on it. And inside of, in the last report that I received, we were averaging on a convenience care, of course this is not Take Care alone, we were at $54 per visit.
So this would be similar to going into a physician's office and having a visit for a particular medical problem. Instead, there's an additional option here. Is that sort of it?
Yes, that's correct. Now, they are limited in the range of services that they provide. So the Take Care healthcare clinics do not duplicate all physician office appointments. There would still be a need at time for our employees to not use the retail clinics, but to use our MedPoint clinics as well. And we don't expect to see a decline because we have more people in need versus appointments right now. So we don't expect for our MedPoint clinics to set open with no one using those by the expansion of this. We're hoping just to better control our cost and the access for our employees.
Okay, so the request is to, Mr. Hester would like to answer the question.
I guess I'm just wondering if we can cut the utilization at the emergency rooms. Is there a possibility we could actually decrease the cost to the county?
There is, for the reason that right now the cost in the clinics, if you go back to your report, let me pull that up here. Of course, this is aggregated data, but if you will see that the cost per visit for the month of August was $104.02. Of course, that's including people who are receiving services well beyond just having a sinus infection treated or something like that. Our cost for convenience care was $54. So there is a difference there. I don't know what the drop will be, but you can reasonably expect there to be a drop. Also, the steerable charges for the emergency room, the expected savings from that is $96,000. So if we can, bring back in just a portion of that, that's still a significant amount of money that we would be saving in the county. The reality is that this healthcare cost is somewhere in our plan. And by doing things like this, we're providing greater opportunity to control those costs. The costs aren't going to go away, and as we continue to add staff to Stewart's Creek High and other locations, we're going to have more people in the plan, and there's going to be more costs that we need to contend with. So it's important we do things like this.
Ms. Stevenson?
On the back page of this, it shows, it says the non-24, the MedPoint clinics, and it's outlined the Rutherford County, and you've got one in there that says 24-hour. Is that a 24-hour clinic that will be available to us, or what does that mean?
The 24-hour Walgreens, actually.
So it's not it's not a clinic that's open 24 hours?
No, it's not.
Other questions? All right, Ms. Ely?
Would our employees need any additional kind of identification to use the retail clinics or the retail locations?
No, ma'am. They'll have the same process that they follow today with MedPoint, which is producing their medical ID card and their driver's license. You do that today if you use a Take Care, and that will immediately identify them as a Rutherford County employee, and it will adhere to. There will be special training for these locations. And they will know that the process only begins at age 3 and up, et cetera. So they will be trained to the specifics of our group.
Ms. Hickerson?
You said that this would run through as the cost as on the Cigna fee schedule. which you said average is for $54. Does that run through the cost that it goes, for example, would it go against my deductible and I'd still have to pay
It would not.
Walgreens clinic, or is it, I hate to use the word free, because nothing is free, because it's on the back end on my premiums, but would I expect, if I had not met my deductible, to get a bill from the Walgreens clinic, from Take Care, that, from my service?
If you are an eligible participant on the Rutherford County Medical Plan, if you're eligible to use the MedPoint clinics at no out-of-pocket cost, then you are also eligible to use the Take Care Health System's retail clinics at no out-of-pocket cost, if this is approved. So it doesn't count towards your deductible, and you don't pay anything out of pocket.
Thank you. Hearing that, I'll make a motion to approve this.
Okay, second, Mr. Hester. Now, do we have other questions or discussion? All right, then, you're ready to vote. All of you in favor of this, then please say aye. Aye. Any opposed? Now, Mrs. Stinson has a couple of important things she needs to tell us about open enrollment, just as a reminder.
Open enrollment begins 8 a.m. on Monday, October the 1st, continues through Friday, October 26th at noon. We have began the meeting process. We have had Board of Ed meetings this week. We'll continue to have those meetings for the next 2 weeks. We have 72 meetings in total. We can't emphasize enough to go online and enroll to ensure that you have the options that you want for 2013. Also, there's several changes this year inside of your benefit options that are available to you. There's also a change on the flexible spending amount account that you can do. So we encourage employees to take an active role in the open enrollment process this year.
And she's also indicated that we will not have an insurance committee meeting in October. Is that correct?
Yes, sir, that is correct.
And will we have one in November, you think?
We're not there yet.
Not
I'm
yet,
not sure.
so we don't know about that.
I just need
Okay.
to survive October.
But October,
1st.
we won't have a meeting. Ms. Harvey?
Quick question about the visit from the insurance department. When you sign the form saying you would like to have more information about the life insurance, do you have any idea about what time they'll be coming back out to talk to those employees that said, yes, I need more information? Is that going to be towards the beginning of October or towards the end?
It actually won't be until November at the earliest. Okay?
So how will you sign up during open enrollment for the life insurance if you don't know the premiums yet until you meet with them?
That product is actually introduced during open enrollment. It does follow a different enrollment process. And so once you've indicated that you have an interest, you will actually be enrolled in November manually by an enroller for that product. So the open enrollment that you need to complete in October is for the benefits that are available online for you to complete.
So that benefit is completely independent of that requirement to be finished by the 26th
Yes, sir, that's
of
correct.
October. Ms. Hickerson?
Just a quick question, just a few meetings that y'all have had so far, are you getting good turnout or any feedback from any of the participants that come to the meetings?
We have had lower than expected turnout at some of our larger locations. I actually requested information pertaining to that today from the enrollment company so that we could get a better feel. I mean, as we looked around the room, we felt like that there was not as much participation as there should have been. I know that one of the principals specifically commented that they were disappointed in the turnout from their staff, which, caused us to believe that there may not be the attendance there that we had hoped. 72 meetings is a huge commitment. It's a lot of cost to do that, so we want to make those successful. So having meetings Monday, Tuesday, and Wednesday of this week was a good opportunity for us to gauge whether or not we need to remarket those open enrollment meetings. So we'll adjust based on the numbers that come back.
Okay, any other questions or comments? If not, Ms. Boney? You want to? Special prayer for them, right? You've experienced this a few times. Okay, thank you very much. Well, we are adjourned then. Thank you.